We're in the studio with Betty Long, registered nurse and founder of Guardian Nurses Healthcare Advocates in Pennsylvania. Thanks for being here, Betty.
My pleasure.
So you founded Guardian Nurses back in 2003. Tell me what you do and why you felt the need for the Guardian Nurses program.
Well, as a nurse, I felt that patients were not getting the kind of care and treatment service that they deserved. So through some personal experiences and family experiences where my family members were involved in the healthcare system, I thought, there's got to be a better way. And so I thought of Guardian Nurses, and that's almost 10 years ago. Guardian Nurses is a patient advocacy organization, so we are shepherds, if you will. As nurses, we'll shepherd patients through the system, get them second opinions, go with them to doctor's visits. If there's a concern about maybe inpatient care, we'll go in and have a team meeting. So we're really there functioning as advocates for the family and for the patient.
Wonderful. So since 2003, you've been doing this, so I'm sure you've come up with a number of things, tips for patients on how to get what they want out of their doctor's appointments, but we know time is always an issue in appointments, so we want to run through Betty's top 5 ways that you can get what you want out of your doctor's appointment. So we'll start with number 5. You say take a written list of all your medications, including anything you're taking over the counter.
Particularly with elderly folks, when you're talking about polypharmacy, there are so many physicians ordering different medications that you want one person, typically your primary care provider, to know what it is you're taking, including vitamins, including supplements, because it all interacts, and you want to make sure that it's safe.
Number 4 on your list, know your health insurance coverage, and this includes a benefit plan summary. Explain what that is and how you get it.
It's more important now with high deductible plans that people understand what their coverage is and how much they're on the hook for, if you will. The benefit plan summary is typically a 2 to 3 page document that can be obtained either through the insurance website, if you're lucky enough to have insurance, or your HR department can provide it for you. We suggest sharing that benefit plan summary with your primary care provider's office, not the doctor, the office manager who does the billing, just so that there's more communication and they understand if there is something that was ordered but not covered, they can help you.
Number 3 on your list, when it comes to test results, understand that no news is not always good news, which I think many people do believe.
All the time. And I can't tell you how many times folks have gotten into the false sense of security that they didn't hear from the doctors. And we just had a patient the other day who's been waiting 5 weeks for a pathology report on a lung biopsy. That is too long to wait. So we encourage people to make sure you follow up. If you don't hear from the doctor's office, call them. Be a nudge.
Number 2 on your list, write down your top 3 questions that you'd like answered during your visit. Why top 3?
Well, if you go any more than that, their doctor's going to glaze over. So we want you to prioritize what it is that's important to you to get from that visit. Because if you go past 3, you only have 15 minutes, you may not get them all answered. We just want to make sure that you get the top 3 answered.
Number 1 on your list, do not leave that office until you feel like you have a clear game plan about what's going to happen next.
Kicking and screaming, do not leave the office. Yes, you want to make, if there's one lesson from this segment, we want you to understand that you are entitled to come out of that visit with a game plan. So your doctor is going to order something or give you something, and you're supposed to be responsible for something, so you have to understand what the big picture is.
Name one thing that you would suggest to a patient to really get the doctor to look at you on a human level.
Yeah, one of the things that people are frustrated about is that they feel like their doctor doesn't care about them. And I think the business of healthcare, doctors are busy, everybody's doing their thing. When you're feeling that way about your doctor, I think that it's really helpful, and we suggest patients say this, is that you appeal to their sense of compassion and say, Doc, I'm really nervous about this, or Dr. Smith, I'm really scared. What do you think this could be? I really need your help. And that kind of softens the exchange a little bit, and then the doctor realizes, oh, you need my help, and I want to help you, and so this will be a better interaction, hopefully.
Betty, thank you so much for being here.
My pleasure.